um, amend our agenda so that we can have our presenter provide us the information that pertains to our health district and how the contract with the city of East Cleveland and the Cuyahoga County Department of Health kind of lines up so that the census data that was a point of contention, if you will, can be resolved. Greetings, sir. If you could, anybody have a problem with amending this agenda so we can allow our presenter to go first and have that opportunity to present the information that is critical to the coverage from the health department?
No problem at all.
Do a Rule 9.
Yeah, I got a problem.
Now, for committee meetings, he can just do it. He don't have to evoke a Rule 9 or anything. This is a committee meeting. He could just
Okay.
change it.
Right, you're right.
Thank
Correct.
you very
His
much.
discussion, he just wants to move 4 and 5, or move
Yes.
number 3 and 4 up to the top.
Yes, ma'am. Thank you.
So
You're fine.
for the benefit of our guests, since we're starting a little late, and I would like to see if we can kind of capitalize on this opportunity, having the subject matter expert on the line. So greetings, sir. How are you?
I'm doing very well, Mr. Chairman. How are you?
I'm well, thank you. So if you could be so kind as to introduce yourself and tell us a little bit about the benefits to having a continued relationship, as well as how the census data is, how it affects the amount of the contract each year. Thank you.
Thank you, Mr. Chairman, and thank you, members of the committee, for the chance to present to you this evening. So the Cuyahoga County Board of Health has been providing services to the city of East Cleveland since, I believe, 1991. I've been here for 30 years in lots of different positions. And we became under contract, the health department for the city of East Cleveland, and I believe 1991. And so we provide a whole range of services. We have about 160 staff and provide services around inspection of restaurants. We do work around lead poisoning prevention, where we work to repair lead hazards in homes. In fact, to date, over the last 5 years, we've provided over $831,000 of funds that have gone into repair homes in the city of East Cleveland to address lead hazards to children. So this is peeling paint issues. It's also dollars that help to support electrical hazards and other things that may cause a potential harm to kids and families and homes. We work with your community development department and receive those funds from HUD. They're competitive, and we're happy to say that for now upwards of 15 years, we've been funded every year in competitive grants and continue to put a large proportion of those funds into help to address homes in the city of East Cleveland. We do work around dealing with rodent complaints and environmental health. We also do inspections of schools. We are involved in responding to diseases and very much, as you know, central in the COVID response right now, educating folks and working to coordinate vaccine provision around the community. And so that's a big job that's been ongoing since last March. We've been working 7 days a week with our staff since last March in response to the COVID pandemic, providing education, doing contact tracing, and case investigation of people that are positive, making sure that they stay home, and also their contacts are quarantined, and also have been doing testing. We've been working to do testing, working very close with Metro Health Medical Center to provide testing sites connecting to the greater Cleveland congregations. So a number of churches where we provided testing at no cost to individuals since May. So we have a range of services in those fronts. We have a grant through the Centers for Disease Control where we've been working to promote healthy food choices in corner stores around the community. And those dollars also are providing services in the city of East Cleveland. And a range of other support services. It's a list that's quite extensive. And we'd like to think that we're a good deal financially. Our rate of $5.45 per capita is among the lowest in the state, particularly for large health departments. There also is a requirement that health departments in Ohio become accredited through a national accreditation board. This is a requirement from the Ohio Department of Health. And I'm happy to report that in 2019, the Cuyahoga County Board of Health became accredited. Now we are in the middle of our 5-year accreditation, so we would be due again in 2024 to reaccredit. It's an extensive process to basically show that you're meeting the requirements of what a comprehensive health department can do in a community. So the rate for your contract is based again on the 2010 census right now. The 2020 census data will be available officially sometime after March. We have 36 other city contracts as well as the 21 villages and townships we serve. We serve every community except for the city of Cleveland. They have their own health department. And so in between the 2010 and the 2020 census, population numbers are estimates and they go up and down. And so we've always maintained the solid confirmed number from census since we've been in existence. So your rate is based on a population number from 2010, which is 17,843 times the $5.45 per capita, which is the same for every city. And that's $97,224. And that's the same as last year's contract. So we're happy to provide a list of more specifics on our programs. I'd like to think we provide a lot of comprehensive services. We've been working with NOAA in the community, also around in our county council, around trying to support opportunities for additional access to healthy food in East Cleveland. Some of that's been delayed a bit by the COVID pandemic. But we are committed to continue to push out and promote coordination around vaccination opportunities, education in the community for vaccination, continue testing. We respond to complaints in the COVID response around masking, concerns about whether stores are complying with social distancing. And we have a call center that's taking anywhere between 500 and 1,000 calls every day from across the county. We put out data to track rates of COVID across the community and how the hospitals are being affected by it. And we do briefings every 2 weeks, sometimes weekly, in coordination with the county executive. Mr. Chairman, that's kind of an overview for you. I'm happy to answer questions. It would be our intent then in 2021, we will have the new census data and we would employ that census data in developing the contract for 2022.
Mr. Allen, Mr.
Hold on one
Chairman.
second, Councilman Martin. Hold on 1 second. Mr. Allen, thank you very much for the information you've provided us to this point. Are there any other things that may require, just for information's sake, that are ongoing that you've not already mentioned that may be beneficial for the audience to know? Things that you can think of that are specific to East Cleveland and beneficial to the audience.
Well, I'm right off the top now of my head. I'm trying to think of something additional. I can certainly provide a longer list, program by program, of where there may be activities involved in the city of East Cleveland specifically. If you look even at the number, just for an example, the $831,000 that came to do home repair is a significant amount of money that is the city of East Cleveland is able to access through being a part of the Cuyahoga County Health Department for service. So I think that's a big one. We, all the food inspection work takes place across the community, and environmental health. And I know that vaccinations, we certainly provide childhood vaccinations. We provide flu shots to the community. We provide, a range of vaccinations for adults, and it's based on people's ability to pay. It's a sliding scale, if people can't afford to pay, then those services are provided by the health department. Those are a number of things that come to mind right now, Mr. Chairman, and I can provide a more comprehensive list to the committee if you would like.
Okay, would you do me a favor, sir? I know that we have been getting some of the information as to the available COVID testing that, within our close proximity. And as those COVID tests, they go quick. And I don't know if you can make it so that we can be on a continuous distribution list for available COVID testing this, not too far of a bus ride and or walk for our residents. Just get on a distribution list.
Yes, Mr. Chairman, actually, we've seen a drop in demand for COVID testing lately since the vaccine came out.
Yes.
And so we have had openings and it has moved around the community. We have a community testing webpage. I will forward that to you through the link that Ms. Kyle provided. I saw you were on an email. I'll forward that out to you for the committee. And it has a whole range of locations in the community where people can get access to free testing.
Right. Thank you, sir.
Yes, sir.
Councilor Martin, if you would.
Yeah, Mr. Allen, can you hear me?
Yes, sir.
Yeah, can you give us the number, the call center number? Is that number connected with the COVID testing too? Is it the same? Is it one number or they're different numbers?
Yes, you could use the same number, Councilman Martin. You would call 216-201.
20,
I'm sorry,
201, continue,
2000.
2000. Now,
Yes.
that number is available Monday through Friday, up to what time, Mr. Allen?
Yes, sir. 8:30 to 4:30, Monday through Friday. And we have a call center with 8 to 10 people answering calls every day. I'll also forward the link to that provides all those locations. They include hospitals, they include drugstores, the testing we do with Metro Health around the community, as well as the community health centers like Neon and other places where testing is available in the community. And so I'll provide the link and the phone number also as a way to access, as a way for you to access testing.
Would you make sure that our clerks, Tracy Udrea Peters or Victoria Deneau, have that link, please, to provide with the other council members?
Yes, sir.
Thank you. Do you see once in March of 2021, when the census data is confirmed, do you think there may be a decrease in the numbers? I think our last census in 2010 was around 17,000. You articulated that. Do you see that impacting your budget if our numbers have decreased by 3,000 or 4,000 people?
Yes, we anticipate, I actually had some numbers of projections that our fiscal officer provided, Councilman Martin, and actually I think we believe that your numbers will drop based on some of the anticipated predictions. It's right now, I think the census for 2010 was 17,843, and the 2019 estimate is right around 17,000, so it's less. So whatever the census, we presume it would be in the ballpark there of that range, whatever that number is that's confirmed through the census, we will use in 2022.
Mr. Allen, I think just to be projections, and I'm not a scientist or a doctor, but the fact that the census was not comprehensive like it's been over the last 50, 60 years, I'm quite sure our numbers may drop a little bit more than the 17,043. What is your professional opinion, Mr. Allen?
I think it'll drop likely below 17,000, not knowing full how the census data are calculated, but based on the estimates from the previous couple of years, Councilman, I would think it would drop below 17,000, but that's an estimate.
Right, and then I think the person who was over this from the past administration under Trump, he resigned, did he not?
I believe you're correct, Mr. Councilman.
Yeah, he resigned. So the census has been quite questionable under the previous administration. So please give us, and thank you for your cooperation. You met with us a few months ago when I had you out. Please get that data to us, especially to our clerk, so she can get it to all our council people. I think if my understanding is correct, Mr. Austin, we confirmed your contract a month ago, I think. We voted in favor of that or not? I'm trying to make sure.
We did vote in favor of it, but it's not my contract. It's actually the residents' contract to make sure they receive the services from the health department based on our part of the state of Ohio and the Ohio Revised Code requirement.
And Mr. Allen, I think the contracts were what, 97? Give me the exact number for my notes.
Yes, sir. It's 97,224. And I wanted to mention, Mr. Chairman, that also one other thing I think is worth mentioning is we were integrally involved with the cleanup of ARCO and work with EPA, where the commitment of we had somebody on site every day to assure that material was removed and done regularly in coordination with all the contractors. So we had a big role in that as well. That's an important point.
Thank you. My last question, and I'll yield to the chairman, Mr. Austin, is about how much money are we getting or we've received in terms of COVID money coming to your agency?
Well, right now, we're paying about 70 people through a temp agency where they're recruiting online to help us. It's because we're getting anywhere between 500 and 1,000 cases of COVID reported a day. So it's a huge number. People are working every day, making calls. We also have in our testing locations, we're testing both, or excuse me, vaccinating both east and west according to the state's guidance on who's eligible for vaccination. And in the vaccination work, that takes 70 staff to run those. So we're getting money from the state. I don't have the exact number. I can get it from my fiscal department, but they've helped us to cover those costs because it's been significant overtime with staff working around many around the clock in response. But it takes 70 staff to staff one of our points of dispensing to dispense 1,000 vaccines in 8 hours.
Is the vaccination designated for people 80 and over? Can you articulate how that's working?
Yes, Councilman Martin. Before, we just are still in the phase where the first phase was called phase 1A, and that was for healthcare workers for EMS. And those folks have been getting vaccinated. In our county, that's a big group because about 20% of our workforce is healthcare. So it's a very large number. And we've been vaccinating a range of healthcare workers. And we still have about 10,000 of those that are left. The next phase, as you note, begins with 80-year-olds. It started January 19th. Next week, the 25th, it will start with those above 75. And then each week it will drop by 5 years till eventually everyone over 65 near getting into February would be eligible. There are 230,000 people over age 65 in our county. So that's a big number. And there are over 22,000 adults working in schools, and adults working in schools also will be eligible later in February to get vaccinated because they want the schools to go back. The governor is encouraging schools to go back face-to-face by March 1st. It's their option. If they choose to get vaccinated, they would have to agree to go back either hybrid, part-time face-to-face or full face-to-face by March 1st. So it's going to roll out that way. Right now, we have on our website, and I can provide that link as well. We have, there are 81 locations in the county, all over the county that are providing vaccine. Pharmacies, hospitals, and community health centers are providing vaccine in the community. And each week, 15,000 more doses are spread out across the county to serve that population. It's not coming out as quick as we'd like, but it's going to continue to come every week we'll get 15,000 more doses. Hospitals are messaging their patients, and drugstores are taking phone calls for people to sign up. And so we have all those locations there for people to see and where those locations are and how to reach them on our website, and I'll provide that link. But we're going to be at this well into the summer and the fall vaccinating. So we're going to be continuing to be busy because we have a long way to go to protect enough of us to assure that we can really see the end of this pandemic. I will also say that that we've been also working to do education, particularly assure that communities of color are aware of how the vaccine was prepared, how it was created through the FDA and the rigorous process that they used. The fact that it's 95% effective. When we had H1N1 influenza, the pandemic in 2009, they also very quickly created a vaccine for that response. So, it has been done before. We have 2 physicians on our board, Dr. Greg Hall, who is a African-American physician who works in nursing homes, and he got COVID. He was in the ICU for 7 days. And he tells us that he was on death's door at one point. He made a determination to get vaccinated because he understands the importance of the vaccine. And Dr. Sherry Williams is a pulmonary doctor taking care of patients and has seen many people die from COVID. She also got vaccinated. She's at Metro Health, African-American physician who wants to promote the importance and safety of the vaccine. So we've been working with a number of radio stations to do promos to assure that we're reaching a range of populations to ensure equitable distribution and education for the COVID vaccine.
Okay, Mr. Allen, we'll make sure that the phase 1, phase 2, phase 3, phase 4, that our clerks get it so we can get all this information to our other council people.
Will do, Councilman.
Thank you very much, Mr. Austin.
Thank you, sir. Counselor Smith?
Thank you, Mr. Chairman. Councilman Nathaniel Martin took my question. It was a great question. I was gonna ask about the effects of the numbers going down. But he already answered it. So I just want to thank Mr. Allen and the entire Department of Health for your services.
Thank you, sir.
Great. Councilwoman Stevenson, you have anything?
Just that this meeting is illegal. That's all I have.
Well, thank you.
You're welcome.
Councilwoman Gallion there?
Do you see her?
I don't see you.
Good.
Okay, so with that, I thank you, Mr. Allen, and if you would like, you can stay or subject to your concerns, that's all we have for you at this time. Thank you very much for answering the call for information and clarifying the usage and or calculations for the census data. We appreciate you and everything you do.
Thank you, Mr. Chairman, and thank you, members of the committee. I'm going to jump up and provide you the data that I promised you right now, and I'll send it along to the locations that you've requested.
Thank you. Take care.
Thank you, Mr. Allen.
Bye now.
Okay, we're going to talk about some of the things, pending legislation and or legislation that is, subject to some discussion in the future and ongoing. So I got an ordinance right here that's talking about 4620 is a piece that's, been a point of contention for our council for a number of reasons. So I'm going to open up discussion and we're going to have a quick dialogue. There is a meeting at a state update from the mayor that started at 6 p.m. So I'm going to try to at least catch a portion of that. So looking at the first ordinance that I have on my list here to discuss is ordinance 4620, and it's talking about an ordinance to amend ordinance number 2620, which makes appropriation of various funds for current expenses and other expenditures of the city of East Cleveland for the period between January 1st and December, January 1st, 2020 and December 31st, 2020, which is old stuff, and declaring an emergency in order to assure funding for police and fire services. There has been several discussions about the temporary appropriations that has been before the council over the last 2 months. And I think that we are at almost an impasse with some of the items that have been either zeroed out or subject to having dollar numbers assigned to them that, have questions. So I want to talk about some of those things that are kind of giving the council pause as to how we move forward. Councilor Martin, what you got on that?
Well, my feeling on this is that we've discussed the budget for the last couple of months, and this is it's a finance issue. And as you know, a couple of days ago, the Fiscal Planning Commission articulated that if something's vetoed out, you can veto it, but you can't put anything in. That came in the Fiscal Commission yesterday. So my suggestion, so that we all be on the same page, that this should be dealt with in the Finance Committee, the Finance meeting, and the Fiscal Planning Commission lady, Miss Matters, if that's her name is correct, gave us another month to kind of work this out. So my suggestion, Mr. Austin, and your intentions may be good, that this needs to be resolved in the Finance Committee, and all of us can be a part of that. Because the appropriations is a finance issue. And Ms. Matters did articulate that if something is vetoed, according to the Attorney General, no one can put another numbers in there. The mayor can't do that. That was my understanding yesterday. So that's where I'm at in terms of 4620. It's basically a finance issue, and it should be taken care of in the finance committee, which all of us are a part of, all the committees legally. Thank you, Mr. Austin.
Right, great, thank you. I appreciate that. And like I said, I got a stack of stuff that, has either been, just kind of caused some consternation at a minimum reference, if you will. I got a stack of things that we haven't really covered well in a myriad of efforts. So every opportunity we get to kind of discuss some of these things or make it so that this information is a little bit more shared, I think it is a good investment, if you will. So I got another note here about those same temporary appropriations and how we got to certain places. And we talked about some of the professional services and some of our employees that would be impacted by that. I got a call today from a resident in Ward 4 asking about, so how do we get to these places and how we come up with the things that are hanging us up? And I don't necessarily have an answer other than, some of the, like I say, in-house gatherings that, I can't say I've been a part of all of them. So I see a note on here about 5420. And it says something about a response from the mayor on some line item veto stuff. And that information spreads like wildfire. So I don't know how we provide response to our community if we don't, kind of put it out there and, kind of discuss it in these different opportunities.
Oh, Mr. Austin, articulate what is 5420? Because I don't have that material in front of me. What was that one?
Right, it says a resolution to make temporary appropriation in various funds for the current expenses, just almost the exact same information, but it's covering 2021. And it has a number in there that says not to exceed $5,678,490.14. This is the council's version of the appropriations. So I wanted to make sure that if just kind of, there's different appropriations. So the council kind of put together their own, no, not me, because I don't have anything to do with that, but they put together their own budget, which would, in my opinion, help me summarize this, which provided supposedly 25% of some of the line items in the mayor's estimate for the 2021 year of operation. And some of the items that were reduced to zero had direct impact on some of our professional services. The professional services were the population that have specific responsibilities, and those responsibilities are not organic to the city of East Cleveland. We don't have somebody that's doing that job every day unless they're a contract employee. And the reason that they're a contract employee because they have a specific set of skills that are not organic to the city of East Cleveland. So this is one of the things that have been, a long pole in the tent, at least for the last couple of weeks. I'm trying to figure out how we provide those services without singling out individuals based on the presumption that is a personal attack. And we don't use the city's resources to personally attack anyone, in my opinion. So if anybody would like to comment on 5420 and the professional services, I did see some email today explaining what professional services consisted of. Anybody like to elaborate on that a little bit before I move on to my next piece?
Yeah, under professional services, Mr. Austin, the basic thing that needs to be done, and I think it was requested by one or two of our council persons, is each department, and there's 5, has a professional services line item. And they know what they've done historically in that line. And to me, to make it plain, to make it very, very simple, is each department head tell what they've done in professional services line item. That should be in writing. That way we can move on. But we've been going back and forth on this professional services line item, and basically the most basic common sense thing to be done is the department head tell what they've done in the last 2-3 years in professional service line item. We spent money in this, we spent money in that, we spent money in this or that. All the department heads should be able to do that, and that shouldn't be difficult. It should maybe to a paragraph or two, what they've spent in professional services. And we've been hung up on that for a while because maybe we're not getting the correct response. So my suggestion as a council person is that the department heads put in writing what they spent in professional services. We can move on this. Okay, we spend too much time on this as it is. Okay, and in addition, Mr. Austin, I'm looking at what it says in your committee, and basically it says that the General Services Committee provides monitoring and oversight on all matters relating to street and sewer improvement, street cleaning, waste collection and disposal, bridges and underpasses, all service department matters such as equipment, all matters concerning supply, sewage, and telecommunication, public utilities, and rates, railway and railroad operation, and Northeast Ohio Regional Sewer District. I read that, Mr. Austin, because basically, again, 5420 and 4620 is a finance issue. So you brought it up because you wanted to have some dialogue where basically it should be resolved. We got a month to resolve it according to the financial planning and supervision by the state. We got a month to resolve all this, but in order for it to be resolved, what must take place is transparency from all the department heads. What is the law department doing in professional services? What is doing? All the departments should be able to provide how they spend special services over the last 2 or 3 years. That's not difficult to do. We need that if we're going to move forward. That is my suggestion. Thank you.
Thank you. I appreciate that. I did make a note. Department heads place in writing the use of their professional services for the last 2 years. I think you said
exactly. Break it down. It shouldn't be difficult.
It should not.
Spend their money.
It should not. But just keep in mind, we don't have a roads division in the city of East Cleveland, so that's a professional service. We got to pay for that. We don't have streets. We don't have the person that would cut those trees we're talking about. We don't have that. We don't have somebody taking care of our services for our sewers, for our septic. We don't have a water department. So these things under professional services, they all impact general services as a committee and as a infrastructure support organization, which this committee is supposed to represent. There's no way, if we don't have the infrastructure capability, that we can support that without this additional discussion right here. So this does have a direct impact on this committee. So
Well, I don't understand how we can have a direct impact.
I will acknowledge you at some point, so kind of bear with me for 1 second, please.
Well, I bear with you long enough.
I'm bearing again. How about that?
Look,
So, Councilor Smith, you have any notes or any comment about 5420, the appropriations that the council generated, if you will?
Thank you, Mr. Chair. I have no comments at this time.
Thank you. Councilwoman Stevenson, you have anything?
yeah, I have something. I want to know if general services is supposed to be responsible for the streets and the roads. Why is general services dipping over into finance and the streets and the roads?
Please.
And the streets and the roads look like somebody dropped a bomb up in East Cleveland. This East Cleveland looks like a third world country when it comes to the repair of the streets and the roads and the sewers and everything else, painting the houses, everything. Nothing is getting done, but you coming over into finance trying to run what finance is supposed to run. I think everybody needs to stick to what they're supposed to do.
Thank you, Madam Stevenson. I'm glad you said that. Right now, I know what the roads take. Right now, we're looking at $50 million to resurface the streets in the city of East Cleveland. That
Sir, we don't have $50 million. We have 1.8.
Exactly.
Okay,
So
just
then what's your
hold
point?
horses, act like you got some bearing, please, and I'm gonna share some stuff with you.
I'm not interested in sharing. What I'm interested in is facts. The facts are, this is
The
the
facts
General
are-
Service Committee. and you're discussing finance issues, sir.
I'm
That's the
discussing
fact.
Professional services. And how it
Professional
impacts the city
services, the line
provider.
item of professional services, you mean the line item of professional services that none of the departments completed on the form where it said that they tell us about what else you spend your money on? Is that what you're talking about?
I'm talking about the form that you generated that did not answer
Yeah,
the
that
question.
form that I have right here
Okay.
in front of me where all of these departments left that block blank.
Okay,
Except for
well,
one or
again,
two who said they didn't understand. And then the law department went on to rattle on about some programs for kids. I don't understand that either.
I
But
don't understand what you're
that's
saying.
what I got back,
So
Mr.
hold on,
Austin.
hold on.
That's
Hey,
what I got back. And
Councilwoman
so
Peterson,
you're
thank you
trying
for
to
your
make
comment.
something out of nothing. And there's
Councilwoman
nothing to be
Peterson, thank
made
you for your
here
comment.
other than folk apparently don't know
You're
how to
not-
fill
you're not
out the form.
Have some bearing. I got that. Thank you very much for your comment. I appreciate it. So we're gonna move on to our next piece of legislation.
And what's the next piece of legislation, Mr. Austin?
I
More
got some-
finance.
I got about four or five documents here that largely pertains to the information pertaining to the CARES Act dollars. This came from Community Development Program Year 2020 CARES Act, Special Needs Cost Increase for the Migration Grant Program. And it talked about several things that the way these dollars were broken out, they came through one hub, and Cleveland was the hub for these dollars to come through. And it talks specifically about the eligibility requirements and who can get these dollars. So I don't know if we as a body, we really didn't do a good job at going through each of the blocks of information so we can have a better interpretation of the left and right limits of these dollars and how they were to be administered, if you will.
I'm not going to allow you to say that, Mr. Austin. I studied that. I know how that money was supposed to be administered. And so that's a false
I'm
statement.
not talking, you're not being recognized right now. Hold your
It
horses. I
doesn't
got
matter
this.
if I'm recognized, I'm setting the record straight.
So if it doesn't matter in my meeting, if you're recognized, then I guess the next step would be for me to act like you're acting right now. So just. if you
You've
could be
done
so
that
kind.
already in every meeting that you come to it with the council. You're an obstructionist. We understand that.
You the
You are
laugher.
Okay, well, just, if you could be so kind as to clerk. This is the General Services Administration meeting, and I just want to share some information. And I didn't write not one letter on this document. So with that,
Mr. Austin, can I ask you a question? And
Please
it's
do.
related to everything you're doing. My understanding that any money that comes in the city of East Cleveland, if it comes from the feds or state or whatever, it has to be accepted by council. And that's basically the issue that we're dealing with here, is that CARES money's been spent, but it really was not accepted by council or shared with council. And that's not to point a finger at anyone.
I'm not talking about the dollars right
Mr.
now.
Austin, and now you need to make a note of this, since you brought this up in your committee, is that all money that comes in the city has to come through council. It has to be accepted by council. If it comes from God, it has to be accepted by council.
Okay, Councilor Martin, I don't know if you recall, but we did accept some CARES Act dollars.
No, we
And-
didn't.
and We did.
Councilman Martin, so we did not, so hold on. I'm sorry, Mr. Chair. I'm sorry, Mr.
You can be recognized, Councilor Smith.
Councilman Martin, so are you saying, because I can believe Stevenson don't know. Councilman
Okay.
Martin, are you
Yeah.
saying that we did not accept,
I know you are not talking about somebody not knowing something.
are you saying that we did not accept the CARES funding already, Councilman Martin? Are
What
you,
I'm saying is the money we accepted some of the money, but how the money was spent wasn't shared with council. That's the thing of contention here, okay?
yes or no, Councilman Martin? Did council accept the funds, the CARES Act funds dollars? Yes or
Some of
no?
the money, not all of it.
Some of it.
Some of it, right, some of it.
You
Right.
sure you been here 30 years?
You know what, you're getting
Hold on,
personal.
hold on,
No,
point of
you're
order,
getting
gentlemen.
personal. When I've been
Point
here
of order,
100
gentlemen.
years,
Hey, Councilor
you
Martin,
always get personal when you go back to that, which is irrelevant to what we discussed.
Councilor Martin.
Okay,
Point of
well,
order.
you
It's
know, you
okay, I
need to
got it.
check him, because he's getting personal. But
got
I've been, he always brings up how many years I've been here. That's irrelevant to this discussion.
Councilor
Really?
Martin, I got it.
Okay,
I got
you control it then.
we're gonna step it up
He
another level.
always gets personal, all right?
I got you. So
Can
Councilman
I
Martin,
get
hold on one
personal
second.
with the fact that he spent $8,000 in fuel and lubricants and he doesn't bring the car back? I can get very personal and you can be
Councilman Martin,
excited for what you're saying, Mr.
control.
Smith.
Councilman Martin,
We've been handing you with kid gloves. You have to explain
Councilman Martin,
how you spent $8,000 in fuel and lubricants. You never bring the car back. You don't
Councilman
record.
Martin.
You're in
Point of
violation
order.
of law. Mr.
Control
Smith,
yourself, Councilman Martin. It's okay.
you are.
Councilman Martin,
Yes.
it's okay.
Okay,
Let's
no,
get back
you
on-
let him
let's get back
go
on
with
track.
personal, and I'm very discreet with trying to get personal, but he always brings that up. So tell me, how can he justify spending $89,000 in the last 2 years on fuel and lubricants? He's the only one doing it. It
Okay.
benefits him and his family. That's personal. Please.
Okay, well, let me share some notes here.
Yeah.
if you would. They talked about how the dollars can be spent and what types of agencies can kind of, how these dollars can be applied. The basic needs for public services, for nonprofit organizations, community development corporations, community-based development organizations, cities, departments, faith-based organizations, subject to HUD restriction. And then there's a list of other folks under the subcategory where these dollars can be administered. So I would like to share this information in a more official capacity with the council. What I did, I brought back some of the information that I had in my box. I'm sure it got to most people's boxes. Some of this stuff, like 2 copies of a document that I'm sure somebody may have made 5 copies of. If I got 2 copies, that means somebody didn't get one of these copies. And I took a look at what community development could do. And the health department said some of the cool stuff that community development has done to this point, and talked about the CDBG funding as well as the ESG funding as covered under the CARES Act dollars. So some of the things that can be supported with CARES Act dollars, as you know, food banks, food delivery, senior services, referral services, emergency utility assistance, homeless outreach, and broadband access. So these are things that these dollars can be spent on. And as you know, when we talk about the food delivery, where there's, a system to support that delivery or the actual purchase of the nutrients for the community, I think that these things are covered. And there are some subcategories that I wanted to kind of run through so that I'm looking humbly for the council to assist me in making sure we put more information out about what the left and right limits of some of the resources that we're going to get, because I just read through some information that said that they extended the CARES Act dollars from 2020 into 2021. And I don't know who else knew that about those CARES Act dollars. So the CARES Act dollars did not expire as we thought they would. So now they're still available through portions of 2021. And there is another proposal to release more CARES Act dollars. So I ask that we all start getting a little bit more informed about what the left and right limits are. And if we have requirements that are specific to our residents, I ask that we start putting those requirements up front and let it be known that these are the things that we would like to do to help our residents realize. And as you know, there is, under some of those subcategories specific to our residents that they can do improvements on their home as well as have rental assistance. And we can match some of the dollars by cash donations, secure grants, donations for non-perishable food, $1.70 per pound if we had to, because right now the food bank and other agencies have been donating food, but this will allow us to make some of those fill some of those gaps for some of our households. And I'm not going to cover the whole document, but I will tell you that this document would allow us to do a lot of the things that the city has already began doing. And I think we don't do enough right now for our homeless outreach and homeless prevention. Not just saying that we're going to put a moratorium on eviction, but we have to do things on the front side to prevent our residents from becoming homeless. And right now, broadband assistance is something we can cover under the CARES, or that can be supported under the CARES Act. So what I would like to see is how we implement some of the broadband assistance that's possibly available, which falls under general services, to support our residents, because of, I really hate to say it, that sometimes there's some of the students that got that little computer that don't have the ample internet service, so to speak. So I think they said that the first 1,000 families would get internet service, but it's more than 1,000 families that need it. So more to follow on that. So there are some things that we have to do as a council, and I'm asking humbly for your support in getting some of these needs met for our community. This is not a catch-all. I don't have all the information. And like I say, a part of the CARES Act was this rental assistance grant program that we got, and this came through CDBG and ESG and home funding proposal. So as we get a little bit closer to what we have to do for our residents, I ask that we take a look at some of these documents. It might be a second look for some, respectfully, but it's imperative that we do take a look at this information because it is critical to the overall survival for our residents during this time. Because I talked to some folks that said that their hours have been cut tremendously at work because X, Y, Z. And when your hours get cut, your money is reduced also. So it's imperative that we kind of go through some of the stuff that would help our residents. I had a couple more pieces of legislation that I wanted to look at, and some new legislation, but I guess I will consider the time. And I want I want the council to be able to take in some of the information that the mayor is online discussing starting at 6 o'clock. So I'm going to get back to the agenda.
Well, Mr. Austin,
Yes, sir.
you always, over the last 2 or 3 years, you always seem to be well informed and know stuff that certain council people don't know. And maybe because you have a great relationship with the mayor and the administration. I think, Mr. Austin, let me finish. You recognize me. I think your intentions for the most part are okay, but you have always, and I need to say this with humility, you always seem to know a lot more, because I think things are shared with you that's not shared with the entire council for some reason. And I don't know why, and that's not now, it's been going on since you've been on council. I brought it up at previous meetings. Why do you have so much information and nobody else on council does? With the information that you share, and the council president should know, if anybody should know, she should know this. Okay, but you seem to get information shared with you from the mayor and the administration that none of you know or the council person has, and that's very concerning to me. Very concerning to me.
I got this out of my box in the council office. This was in my box in the council office.
You're not a member of the administration, but you seem to be a strong advocate of everything going on up there for some reason. Why is that, Mr. Austin? Tell me why. Please, tell me why. Do you know so much and have so much information, and none of the other council people have this information? Answer that for me, please. Please.
I read this. That's what I did differently. I actually read the information that's in our box. That's what I do differently. I actually read the information or I ask questions of the person that might have the solution to the issue. Just like I called the health department because I had a concern about where we were with the census, that I didn't want to think of it for myself. I didn't want to say what I heard the mayor say. I actually want to have
well, you need to say what you're advocating for them. You need to say what the mayor has to say. Okay.
I'm advocating for what's right.
You advocating for the mayor.
I'm advocating for what's right. I'm not advocating for the mayor.
Yes, you are. Yes, you are. You're very consistent with it, Mr. Austin, to the detriment of the council. You're dangerous. You're very dangerous.
The person hold on. Councilor Martin, finish your thought.
What you're supposed to be doing.
One microphone at a time. One microphone, please. So, Councilor Moore, you have anything else you want to say?
Yeah, what I need to say is that the question about the CARES Act funds was we needed specific answers about that, as well as the professional services, and we don't get these answers. It's almost like they're told now. There are 5 department heads, and I'm going to say this one more time. Anything related to professional services in the different departments should be provided us in writing, not verbally. That includes child and all of them that have professionals, even the council. How we spend our professional services. We've been asking that question for almost 2 months and haven't got an answer to that. Mr. Austin, do you have that answer? Since you have such a great relationship with the mayor and the administration, do you have an answer to that? Why we can't get answers to professional services? Why is that? Why can't we get these answers? Why we've been dealing with this for 2 months and can't get something in writing so we can end this? As what's being spent in finance, what's being spent with the mayor, what's being spent with all the departments. Why is that difficult to get? You seem to have a relationship. Can you bring that about, sir?
Read.
Can you?
Well,
Read.
Councilor Martin, I would like to think I have a pretty decent relationship with everybody that's willing to share the information and have a decent discussion, and that's what I do. I've actually reached out to you on several occasions when I had a concern, and you've been able to help me with some of those concerns, and I do appreciate that. So I don't know if you remember that. That's how I do. If I got a question of you, I sit there, take my notes, and that's how I retain this information. These were my notes from some of this stuff had like Dr. Guy's name on it. You know, some of the cover sheets had Dr. Guy as having been the person that put this information in our box. The only thing that was different, I was able to recall that I got that information, went back to the location where I filed it and pulled it out. And this is old information. And, you know, I would like to be able to have a little more open dialogue and information sharing with the rest of the council. I would, and that's what I took this opportunity to do. This not I'm not on anybody's side. I just want the residents to be okay. Period. So, and that's the bottom line. So I did take the note, and I will do everything I can. I'm going to type a paragraph when I leave here or after this meeting to, you know, explain a little bit more in detail. And just as a reminder, I don't want you to think that I'm not listening, because I am. I noticed that the requirements have changed like a moving target, and it's very difficult for any person to hit the moving target. Trust me, because I try every chance I get. I don't want to show you my example, but I do try to hit the moving target, and it's not easy. So I'm going to say this is what we need, absolutely what we need in order for us to be okay. And I do appreciate the fervent dialogue, and I have no problem with it. And I do, like I said, I appreciate it, because I mean, we care enough to express our perspective in a passionate manner, because we want the same thing for the residents to be okay. Moving on to disposal of city-owned equipment, there is some stuff that we've been talking about. Some of the vehicles that we agreed to displace have been displaced, but every time we talk about I wish the mayor was online so he could tell us about the new batch of equipment that we should see in some legislative form to be disposed of. So unfortunately, there is that meeting that's going on right now. So I'm going to try to breeze through these few things so we kind of get the end of that. Thankfully, the clerk enabled us to move beyond the Cuyahoga County Board of Health contract, which I hope we got the information we needed about the amount of money we should pay. We enjoyed that presentation from Mr. Allen, and I do appreciate that. And I welcome other presenters to come and kind of share with the council things that might make us better. And I pray today that I can be better for the benefit of the council as well as our residents. Proposed repair and upgrade of city-owned buildings. I know that we all know that there is a move afoot to help us. If we get some more CARES Act dollars, I would like to see the bathrooms truly touchless. I know that little thing, you still got to hit the button for your hand dryer to work. Only one faucet in the downstairs public bathroom works, because the other one doesn't have pipes at the bottom. We want to be able to have those faucets where you kind of wave your hand in front of the faucet and it allow you to get some warm water, and or wave your hand in front of the soap dispenser and you get soap without having to beat that nasty thing. And sometimes it doesn't have soap in it. So, and that's not a jab, but that's a fact. So I would like to see our facilities improve. So more to follow, So future leasing of vehicles. There are some vehicles that are right now, and we just approved some, and I do appreciate the council support in getting some of those needs met for our department. There's still some out there that needs to be, in my opinion, replaced in certain sections, whether it's building, housing, and or the service department, starting to get some systems that has been force multiplier. And if you could, do the job of 10 men with one piece of equipment, I recommend we get that piece of equipment and allow the personnel to do great work to directly interface with our residents and make their lives and their, I guess, I shouldn't just say their lives, but their standard of living, quality of life, I should say, a little bit better. So at this point, I've been talking a little bit too long, so I'm going to ask if anyone else have any additional information for items 1 through 6 before we get ready to close this meeting out with the last 2 issues.
You brought up, Mr. Austin, you brought up about the leasing of vehicles, and I think we passed something just recently
We did.
for the fire and police, correct?
Yes, sir.
So that's a good thing,
That's a great
Uh,
thing.
all right? And I would also say that we're almost into February, and we've had maybe 1 or 2 snows. So we haven't had so far, we haven't had a harsh winter. So that's a good thing. I will commend the service department. They've done pretty well in cleaning the streets. I want to commend the service workers. They some of our best workers. General updates regarding general services. I guess that's your closing. I'll leave it there to remarks to the closing remarks. Thank you, Mr. Austin.
Thank you, sir. Going on to seasonal service department information updates. As you know, they've been trying to hire the right people and getting the right folks qualified, which they have to a large degree. So like you said, I'm glad it wasn't a harsh winter to this point. But luckily for us, we have the salt on hand that we need. We have our systems working mostly. I guess I should say mostly work because I can't confirm or deny what's in the shop this week. Because as you know, we get a vehicle in the shop at least 1 or 2 a month. So I haven't had the opportunity to confirm what's in the shop or not. On the next update will come from Mr. Marshall, who I've asked him to come on and at least kind of advise us on the left and right limits for solid waste collection in the event of the Rumpke misses picking up some trash. How do we respond to that, and where our left and right limits are? And I before I would go straight to Mr. Marshall in the service department, he told me since that is a kind of a building and housing issue, I should probably be going through building and housing. But as you know, Mr. Marshall is indeed a phenomenal and yet humble servant. So if you call him, he will get up and go do the work as opposed to sending you through the long gate, if you will. So I do again want to echo Councilor Martin's appreciation for the service department, because again, it wasn't necessarily his issue to resolve, but as I called him, he's always found a solution. Maybe not that day, but a solution was ongoing, and he was able to provide that for us. And I do appreciate that. Okay, so I just got a note from the finance director who let me know that the road salt also falls under that line item number for professional services, because obviously that's something we don't do, and we take advantage of the economies of scale. That means that when other municipalities buy salt, we also buy a portion of that big bundle or big, I guess, provision of salt. Just different things. And I think I really want to say that as a council, I think we need a little bit more information. So we can kind of line up the pay schedule with the pay requirements. That means we plan it out in a way that we can actually see what's coming and predict it. And this is our kind of, rough year for our finances. Our finances have increased. But the information associated with some of those finances, I guess we're getting down to the nitty gritty. And I think that there is an opportunity for us to make it better for the future, and how we do that by asking the right questions of the right people. So I would like to know a little bit more about what's going on. I have been provided a lot of information because I've been going either to the finance director directly or asking of the mayor specific questions on how do we get to a certain place and the plan. So I will continue to study, learn, and grow. Any other comments before we go to remarks to the public?
I'd like to say something after we get past the remarks to the public.
Okay, you will.
Okay, thank you.
Thank you. We'll have remarks of the public. 2 minutes, please. Remarks of the public. Okay, excuse me. Hearing none. Councilor Martin.
Yeah, I want to thank you for your meeting, and thank you for, I think your intentions are good. I think that philosophically, for everyone listening, the COVID has been a paradox, an irony, or a paradox to some extent, because we've got almost $4 million that we would never have gotten. And that money's been able to sustain our safety forces, which is our fire and police, and do some things that we haven't had a chance to do. Now that we have a new administration in Washington, Joe Biden and Kamala Harris and that, we'll probably get some more money. Well, I hope that we use that money wisely. And as I advocated all of 2020, every dime that we of this COVID money, we got an extension on some of it, let's spend it. We need to spend it. We have some of the best cars and vehicles, updated vehicles, I think, of any police department in Cuyahoga County. It's because we've been able to use some of this money, some of the money we've been getting to buy new vehicles, to do things. I will also commend that we have I saw the floors a couple of weeks ago. They're shiny and they look real good because we've contracted with someone that's cleaning the floors, and they're doing a pretty good job. This is in addition. So we've benefited paradoxically from the COVID money. The only questions that's come up that we have a right to have an answer to is, one, how the money's being spent, where the money's going, and that. Besides, we do know it's going toward helping our fire and our police, but how it's being spent elsewhere has been somewhat contentious. And I think those things can be answered. And in closing, under professional services, all the department heads are aware and knowledgeable about how they spent that money over the last few years. Just give us that kind of breakdown, and we can move on and not only pass the temporary budget, but pass the permanent budget once we get these questions answered. That's the only holdup. We would be irresponsible as council people to not have this taken care of and not have these questions answered. That would be irresponsible of us, because once we give the mayor his budget, he's good for all of 2021. So I hope that we, in the 30 days that was given to us by the Financial Planning and Supervision Commission, we should have all these questions answered. Then we can approve the permanent budget. Mr. Austin, I have spoken. Thank you.
Thank you, sir. Councilor Smith?
Thank you, Mr. Chair. I want to thank my colleagues. I want to thank anyone that's online from the administration, Mr. Director of Finances, Madam Director of Law. But most importantly, I want to thank each and every resident, our neighbors, for taking the time out to join us on this Zoom meeting, this very important and different type of meeting. I'm talking about the Zoom that we've had to encounter all of most of 2020 and now 2021. Really thank you, because you could have been anywhere else. These committee meetings are very, very, very important, as you see. Just a couple notes. Jam Pro, that's the company that's cleaning City Hall. The breakdown of each department spending is on the monthly financial report. Another note, the COVID funds are, the state already dictates how the COVID funds must be used. If they are not used correctly, we are getting in trouble. We accepted those funds back in, I believe, November. Yeah, that's all I say on that. So again, thank you for joining us, and look forward to seeing you again. That's all I have, Mr. Chair.
Great, thank you, sir. Councilwoman Stevenson? Councilwoman Stevenson?
She's not here.
Okay, great. As we get ready to close out the General Services Administration meeting, I did see the resolution that we passed out was resolution number 16-20 for accepting the COVID dollars, if you will. I'm not the COVID expert, but I did go back and reread my notes, and it was informative, and I do appreciate the opportunity to kind of share some of those notes with the rest of the council. Just as a refresher, not necessarily an introduction, but just a refresher. I do appreciate Mr. Allen from the Cuyahoga County Board of Health who came on to let us know how the contract was written and what metrics they used in order to advise us on what dollars we owed them. So the 2010 census was used to be and expected to be effective until March, as he said. But the Ohio Revised Code for assigning health districts assigned each city a responsibility to pay for their coverage. And it's per capita, I mean, per citizen, you have to pay a certain dollar figure, and he provided us that dollar figure. And the council thank everybody as a team, if you will, for supporting our residents in this matter. Professional services, those services that we cannot provide ourselves as a city. And I am going to ask for narratives by department to give the council in great detail what those dollars were spent on for the last 2 calendar years. As we talk about legislation, as you see, we take the legislation that we pass and or are responsible for overseeing very seriously. I do specifically, and I'm gonna mostly talk for myself. I do appreciate the magnitude, responsibility, and the, I guess, blessing. I'm gonna call it a blessing to have the opportunity to serve the people of East Cleveland. I am not afraid to go forward, into a dark place so that you can be okay. There are things that we do on a regular basis to show how focused we are on doing what we believe to be right. And I ask that you continue to bear with the council until we either confirm the things that we are concerned about. I get calls and notes from residents saying that, some of the things that we do to express how we feel about a certain issue cloud the issue. So as we go forward, I ask that we consider how we handle each other and kind of use volume as, a good thing. You see, present your information in a way that is better received and it's clear so that, it's not perceived as a fight between 2 individuals. Because I like to have the discussion, whether I agree with you or not, but I want to be able to understand what you're saying in a way that, I can kind of empathize with you. So with that said, I do want to say I appreciate the council and I want to continue to learn and grow with you. And I ask that we all keep the main thing. That means providing for the quality of life for our residents, as well as truly representing their words, their goal, their intent for their city's public officials. So with that, I'd like to adjourn the General Services Administration meeting at 6:48 p.m. All in favor?
Aye.
Aye. Thank you, and y'all have a good one. Thank you, Madam Clerk.
You're welcome, sir.
Bye-bye.